thank you so much for coming. So today I'm not going to keep you too long. I just wanted you, as you might have heard, you have a new therapy company here. We're called AdvantageCare. I work for AdvantageCare. I am a speech therapist, but I also am the compliance director for the company. And they asked me to come and just talk a little bit about speech therapy because I know some of you guys know a little bit more about speech therapy, but I don't think a lot of people know exactly what speech therapy is and how we can help, and that's why we're here. We want to help you. And I do need my glasses because I just turned 51, like I was telling you ladies. But I do want to tell you a little bit about, so I have been a speech therapist for 29 years, which is a long time, I think, to do anything. I joke with people and tell them, though, I started when I was 5. So that's how I've been a speech therapist for that long. I actually grew up in New York. I live in Pittsburgh now, so I just drove in from Pittsburgh this morning to see you ladies. I have 2 kids. My boy is at Penn State up here in State College, and I have a daughter in high school who keeps me on my toes. But let's get to why I'm here and get going on this. Okay, so the first thing that people sometimes ask me is, what is speech therapy? I don't need that. I can talk just fine. As a matter of fact, my husband tells me I talk too much, So, and we know that, everyone hopefully can communicate and things like that. But sometimes when we get a little bit older, or if we have some kind of condition or a stroke, God forbid, our speech can get affected. And that is definitely one thing we can help you with. However, speech therapy can also help you with how you're thinking, how you're remembering, how you're swallowing, and a few more things too. And of course, our goal is to keep you as independent as we can. So you guys know what the word cognition is, right? It's just kind of how you think and things like that. But I think sometimes people say, well, how are you going to teach me how to think better? But that's what we do, is we first assess you and we try to figure out what kind of problems you're having. Because cognition includes how well you pay attention, your memory, how you solve problems, how you do anything that you do every single day. So for example, remembering to take your medications. I sometimes forget to take my medications. I have one of those doohickeys too, the Monday, to Friday, and I think, wait, did I take that? So, following a recipe. Maybe you found a new recipe, like Rachel Ray's one of her recipes, and you want to follow that, and you're like, wait, did I already do that step or not? So that's all about how you're thinking and staying organized up here. And also, part of cognition is when you ladies are having your nice chats, being able to follow the conversation and not forget what someone had just said, because that sometimes happens too. Okay, so how can we help? Like I said, if you or a loved one were to come down to meet with the speech therapist, we have a bunch of tests that we have to do first. They're kind of fun, actually. But it kind of gives us an idea of where you are with certain things and how well you do, because we always want to take what you can do well and kind of build on that. And then we kind of personalize goals to what you want to be able to do. So if you came to me and said, I am kind of forgetting if I paid that, my bills or not. So we'll work with you and set up an organization strategy, things like that. We want you to be as independent as possible. So, I know that's really small, but so here's some examples of things that you might start to have trouble with. Remembering people's names. Do you guys remember my name? That's because I told you about Mitzi Gaynor. And remembering when you have appointments. I'm sure you guys have calendars on your fridges or something to help you, but those are also things that we can suggest. And then following stories. If someone's telling you a story at dinner and you're having trouble kind of keeping track of what they just said or where they're going. And then just staying focused. And maybe you had a hobby that you used to love to do and now you don't feel like you can do it because your mind is starting to get a little fuzzy with things like that. Okay. Now, the reason why they asked me to come talk to you all today was to talk about mostly cognition, because if you're living here in this community, you're physically doing really well, right? You're able to take care of yourself. You're able to do all the things that you really need to do. But if ever anything were to change, speech therapy also, we can help with people that start to have voice problems. As you get a little bit older, sometimes your voice starts to change, and maybe you don't think it's normal. So that's also something you could inquire about. Also, how well you're understanding people, and swallowing. So I think the swallowing is the one area that people they don't associate speech therapy with, but that is a big part of our job. Maybe you notice that it's taking you longer to eat your meals, you're having trouble chewing, you're coughing a lot more during your meals. Those are sort of concerning. Another sign I tell people to look for is if your nose starts to run a lot when you eat. This happens more with men, I've noticed. But if you notice that you're like, I have to blow my nose every time I eat, doesn't mean that you have a swallowing disorder, but it could be a sign that you're starting to get a little weaker in your swallowing muscles, okay? So that's something to look out for, but we can help with all of that. And then, again, God forbid, if something were to happen down the road a little bit and you lost your ability to speak or speak as well as you're used to, with technology these days, they have all sorts of things that can help you. And we are the ones that would, help facilitate that. Okay, so what are the signs that someone might benefit from speech therapy? And you know what? You might think that you or your loved one really needs it, and you come down and we do an assessment, and lo and behold, you scored 100% on everything, and we think you're fine. And that's great news, right? But you won't know until you find out. But even the friends that you have here, if you start to notice something about them, you could suggest to them, hey, maybe you should try that and see if they can help you at all. So what are some of the signs that someone might benefit from speech therapy? Let's say you're having a conversation and you notice they're saying, that thing. You know what it's called, that thing. But then they can't actually come up with the word. Now that happens to me all the time. But if you notice that it's starting to happen more and more, and to the point where you're having a conversation and they can't really come up with a lot of the words that they're supposed to be saying. So that could be one sign. Or following directions. So let's say you say, hey, meet me at the chapel at 1:30, and then you notice that they don't show up, or that they forget that you said that. So remembering directions and then being able to follow them. I know that's what happened with you ladies today. I'm not saying that that's a big red flag, but it is something to pay attention to. And then, of course, changes in memory, attention, safety. Falling is a big risk factor that can indicate a lot of things, right? It could indicate that you're getting weaker, but it also can indicate that you're having trouble remembering how to be safe. So that's a sign also. And then repeating questions. So if you're talking to your gal friend at lunch or dinner and they ask you, hey, how's your grandson? And you answer, you take a bite of food, and then they say, hey, how's your grandson? So, is that me? Oh, okay. So if you notice that someone is kind of doing that a lot, that is something that you should probably, bring to their attention. And then, like I just said, coughing or choking during meals, nose running, food getting stuck in your mouth, feeling like you have food stuck in your throat, things like that. So those are all the signs that you'd want to pay attention to, either for yourself or for somebody else that you know and love that might be having trouble with that. So why is it great that we have this partnership here at Chapel Pointe with Advantage? That's my company. Number one, you don't have to go anywhere. We're right here downstairs. You have to go on an elevator ride, but you don't have to leave the campus, which is great. We also work real closely with the other therapies, physical therapy, occupational therapy. I'm sure you guys have had one or the other, but we work real well with them and try to make the therapy fun and kind of collaborative. And then, of course, the nursing department, too. We work with them to see if they've noticed anything as well. And our goal always is to keep you as independent and safe and connected to your friends and family as possible. So the next thing I want to go through are real quick. These are, obviously I haven't put their real names here, but these are examples of patients that I've had, in the past or recently, and maybe this will strike a chord with someone that you might know. So let's call her Mrs. P, okay? She started to have trouble keeping track of her medications and bills. She started to get letters that, hey, you forgot to pay this bill, we're going to charge you this late fee. And she said, I swear I paid that. So she was noticing that. And then also her medications, she kept getting refills mailed to her, but she's like, wait, I still have all these left. It's because she was forgetting to take a couple. So she came to speech therapy, she came to see me, and within a couple weeks, I taught her routines, her pill organizer we labeled, made it more clear. We had checklists, and now she left and she was way more independent, just felt more in control. We had a lot of fun, actually. Okay, then I had somebody named Mr. H. And as I just said a few minutes ago, he kept doing that thing where he said, I went down to the thing, and I had the thing, and then we did that. I said, that tells me nothing about your day, So he was having trouble. It's called aphasia, when you forget the name of things. It's usually pretty subtle at first, and then it starts to snowball and get a little bit worse. So his wife is the one that actually came to me and said, you have to help him. She said, I don't know what he's talking about. And he's getting mad at me because I don't know what he's talking about. So he came to me. He was a little bit resistant to work with me, but we started to get along real well. There's strategies and practice that we can do to help you find the right words that you need to say. And he got more confident. And, was he perfect after? That's not a guarantee, but did he get better? Absolutely. My next example is Mrs. B. Her friends were the ones that noticed she was coughing a lot during meals. And they said, you better go get that checked out. So she went to the doctor, not realizing that she could have just gone straight to the therapy department. And the doctor said, you have to go see a speech therapist. So we went. Now, there's a big variety of swallowing problems that can happen and a big variety of ways we can help you. Usually when you hear the phrase, it went down the wrong pipe, if that starts to happen more and more, it's usually more than just an accident, okay? Because your swallowing muscles get weak as we get older, just like your biceps get weaker as you get older. All those muscles in your throat have to work together at the exact right time to get the food to go down into your stomach, right, your esophagus and your stomach, and not your airway or your trachea, and go right into your lungs. So that's why people get pneumonia, right, because they start to get food and liquid into their lungs, and the bacteria forms, and so I'm probably getting a little too scientific now, but that's kind of what happens. And swallowing is one of the first things you do as a baby. No one has to teach you. You cry, and then you start nursing, right, or drinking from a bottle. No one ever has to teach you. So we take it for granted that as we age and might have certain conditions, Parkinson's, even dementia, our bodies start to not know how to swallow anymore, and who doesn't love food? We were just talking about chocolate and how much we love chocolate, right? So maintaining your ability to swallow safely is super, super important. Some people find it embarrassing to talk about, but it shouldn't be that way. And again, speech therapist and I will, we all are very confidential about everything. We can help you. So anyways, Mrs. B, she was coughing more during meals, and her friends said, you better go get that checked out. Turns out, we do recommend that they get a swallowing test. It's basically you get an x-ray of you while you're eating something that's coated in barium, and we can see exactly where that food is going. And she was starting to have trouble. So how do you fix that? Most of the time, we have to kind of change a little bit of what you're eating and how hard it is maybe, or how chewy, but we don't have to disrupt it completely if you don't want to. So it's tailored to what you need. And then she started eating perfectly safe again, using a few strategies that we taught her to make sure she was safe with how she was swallowing. Okay, this is my last one, example. Mr. T, not the guy from the show from the 80s. That's a throwback, right? He had a stroke, but he was doing okay. But then he noticed that he would try to talk to his friends, and they'd say, "What'd you say? What'd you say?" Over and over. And he thought, well, is it their hearing? He said, "No, I think it's me." So that's why he came to speech therapy. Because of his stroke, he was starting to slur his words a little bit and becoming harder and harder to understand. So he came to us. We practiced a lot of slow speech, getting, maybe over-pronouncing things until he got more used to it. And now he's back to talking to his friends, and they say he never shuts up. And so that was a success story. So I hope that gives you a good idea of the types of things that we can help you with, right? There's a lot more, but in the interest of time, I don't want to go over all of them. But those are the main areas that speech therapists are excellent at, we hope. And so then you might be saying, well, okay, I can think of someone that I know that would benefit from this, or maybe even myself I could benefit from this. How do I get started? So the first thing I'm going to advise is that you talk to your doctor. You don't have to go see them necessarily. You might be able to just call them or use the app or whatever way that you communicate with your doctors now. Because if you have a script, a prescription for speech therapy, it makes it a lot easier to get started. If you don't and you forget, that's okay, but that's probably the first thing we'll tell you. So just like any other type of therapy, the doctor has to approve it and write you a prescription. And then if you have that in hand, then you can call down to the therapy department. So our director of therapy, her name is Alexa. Whenever I say her name out, at home, my little Alexa thing goes off. So I've been calling her A now. But you can contact Alexa. And the last slide, I'll have her phone number, but you guys know how to get in touch with the therapy down there. And you say, hey, I have this, I did call my doctor. And of course, in between all these steps, we have to talk about that horrible word, insurance. But Medicare, generally covers speech therapy. The business office here is excellent. They'll work with you on any copays you might have or all those things. We don't really deal with the money part of it. We just give the therapy. We don't collect any money. It all comes through Chapel Pointe. So that's who you'd, get that information from. But I do know that's important. That would be important to me. So that's something I wanted to mention, that you could just find all that information out before you committed to anything. And then that's it. Alexa would schedule you for an evaluation with a speech therapist. Now, right now, we have a speech therapist who comes in a few times a week for just part of the day, but we are actively looking for a speech therapist that could be here more often on a regular basis. And so once we find that right person, I was going to say she, but there are some male speech therapists. There's a lot of them actually, but generally it's a very female dominant field. But once we find the right person that we think would fit in with Chapel Pointe and still be fun and engaging, we'll have a lot more time in the schedule to get more evaluations fit in. But regardless, don't let that stop you. You can always call down to Alexa and say, I'm interested in a speech therapy evaluation, and then she'll schedule you. So up here I have her phone number and her email and all that, but if anything, you could always just call the receptionist. I'm assuming you have a receptionist type person here, and she can help you. So, okay, we're nodding. Yes, we have a receptionist. And just say that you want to talk to the therapy department. Well, that's all I have right now. Do you ladies have any questions or anything?